sometimes a heart attack is just waiting to happen. More than 1 million heart attacks a year. That's one just about every 30 seconds.
A new report from the Centers for Disease Control and Prevention says 200,000 deaths from heart disease and stroke could be avoided each year.
Every year, 500,000 Americans undergo coronary bypass, and over 1 million more have angioplasty or a stent procedure. Do you know the secrets to reversing your heart disease? They're simpler than you think.
Dr. Dean Ornish has studied and written about diet and heart disease for decades.
This man is one of my heroes. I have been following him since I was a resident. He is the very doctor who turned the medical community on its ear with his groundbreaking findings on the heart.
The doctor and the program that has healed thousands of hearts. You've seen results in 7 days.
Your body has a remarkable capacity to begin healing itself.
Because your body is trying to help you out. For over 20 years, Dr. Dean Ornish has been making headlines as the first doctor to prove that heart disease can really be reversed by changing your lifestyle.
I remember the skepticism that greeted you when you talked about reversing heart disease, and then it proved to be the case. It's possible to change the disease by changing the way you treat it, by your diet, by your lifestyle. And Dr. Dean Ornish, the man who 20 years ago told us that dramatic lifestyle changes could reverse heart disease, now says the same could be true for prostate cancer.
We found that in more than 30 years of research, the more you change your lifestyle, the more you improve in pretty much every way we could measure. And we also now found for the first time that we can actually, in many cases, make telomeres longer. And your telomeres are the ends of our chromosomes that control aging.
Our genes are not our fate, and if we make these changes, they're a predisposition. But if we make bigger changes than we might have made otherwise, we can actually change how our genes are expressed.
I asked him if he would take a look at the White House menus. The food was delicious, but was there something more we could do to perhaps combat and even prevent some of the problems that come from not paying enough attention to nutrition? Well, Dean has really led the way in helping all of us focus on the everyday lifestyle choices that we make and the impact those choices have on our health. What we eat, how we exercise, respond to stress, how we support and nurture each other.
Dr. Ornish's prescription for heart patients includes yoga, meditation, and group sessions at his institute in Sausalito, California.
If you change your lifestyle sufficiently, you can reduce angina or chest pain by 90 to 95% in just a few weeks simply by changing diet and lifestyle.
People who have a strong sense of love and community and connection and intimacy are 3 to 10 times less likely to get sick and die prematurely than people who have a sense of loneliness and isolation.
Medicare is now covering our program for reversing heart disease, and we've been training through a company called Healthways based in Franklin, Tennessee. We've trained the Beth Israel Medical Center in New York, UCLA, the Cleveland Clinic, WellPoint, and most other insurance companies are now following Medicare's lead. So we're really trying to create a new paradigm of healthcare rather than sick care, and it's working.